acts like spell check, where every single time your doctor looks at their x-rays, Pearl is there as a second opinion or a second set of eyes to ensure that if there's early stage pathologies, nothing goes missed, or even helps you as a patient understands for the first time your x-rays now in color.
Welcome to the DSO Technology Show. I'm Brian Kaleo, Director of Dykema's DSO Industry Group. I'm here with my co-host, Matt McGaw, and our very special guest today is McKenzie Fagan, VP of Enterprise Sales at Pearl AI, and it's one of my favorite topics. I've said this over and over again, Matt. Diagnostic AI is the single biggest advancement in the history of the dental industry. I know how broad that statement is or how big that statement is, but I really, really believe it. We're really honored to be able to talk about it today. And McKenzie, thanks for being here.
Great to be here. Thanks for having me.
So let's kind of dive right in here. And I always start with, look, I've encouraged everybody to really understand and take the time to research diagnostic AI. I understand, though, some people that see this might have been busy. It might be difficult for them. Maybe they want to learn about it. They haven't had the time. So let's start there, even though I know Pearl's been around for a while. It's got FDA clearances, all kinds of stuff. But just assume maybe somebody watching this has no idea what diagnostic AI is. And can you take us through that for a second?
Absolutely. So Pearl is a radiologic AI platform. The best way to think about it is Pearl looks at your x-rays and is able to find and detect pathologies on those x-rays earlier and often than the human eye can. I think the best analogy or way to understand it is doctors look at your x-rays to determine what your treatment plan is going to be. Pearl acts like spell check, where every single time your doctor looks at their x-rays, Pearl is there as a second opinion or a second set of eyes to ensure that if there's early stage pathologies, nothing goes missed, or even helps you as a patient understands for the first time your x-rays now in color. You can actually see and understand yourself what's going on in your mouth.
Right. I actually, I wanted you to explain this certainly, but I've had some experience with this. I mean, we now have my famous trip to the dentist. They had a camera crew follow me. I think, tens of thousands of people have viewed it. But what it's like from the patient experience is you're sitting in a chair, and before, because I've been going to the dentist for like 50 years, like previously there'd be this black and white thing up there, I know, and you'd look at it and the dentist would just explain it to you. Like, I see a cavity there, and you would have, at least if you're me, you had no idea what they were talking about, if it's true or not. You hope you have a good dentist and you just can trust them, and that's it. But I could not in any way interpret anything that was going on in my x-ray. But since I've had the experience of utilizing Pearl AI as a patient, all of a sudden a pink dot shows up there. And from the standpoint of the patient sitting in the chair, you see a pink dot up there. And I want you to talk a little bit about this, but it kind of overlays the x-ray, and then the doctor will explain, but now you've got context sort of for what's going on.
Absolutely. And where it becomes really interesting, too, is when you compare historical images. Maybe your doctor tells you that you have an early stage cavity, but you don't feel it. There's no pain. You don't really understand why you need to do anything about it, so you leave it as a watch tooth and you don't treat it. Well, you come back 6 months later, or maybe even a year later, and take x-rays again, and now you're able to see with Pearl, that used to be a really small pink dot. Now it's a really big pink dot, and we've got a significant problem. And this becomes a lot more fun, where Pearl will actually analyze all of your historical or your previous x-rays that were taken, so you don't have to wait those 6 months for it to become a problem. If you're using Pearl, you can open up your images, look at your images that were taken a year ago, and see how that disease has progressed, so you can treat it.
Well, that's something relatively new, I think. I want you to tell me, at the beginning, when I would talk to people from Pearl about how it works, in real time, you'd sit in the dental chair, they would take the x-ray, Pearl would overlay, and just based on where you are at that moment in time, it would tell you what's going on. But now I understand it can retroactively go back through other x-rays and other things, even people that are not, if I'm remembering correctly, in the chair that day, it can go back and look at them. and you can recall them. You can get on the phone and say, hey, you came here a year ago or 6 months ago, and come to think of it, it looks like there's an early stage cavity and we want you to come back in, or something like that.
You nailed it. So we've been able to look historically for years. Typically we don't go any more than 18 months in the past, just becomes clinically insignificant, but up to your provider. That's why it's their choice to decide how far they want to look back. But where this becomes really interesting is from an operational perspective. You now get to see the beginning of the funnel, if you will. If you're a DSO operator, before Pearl, you were only looking at really what you got in your practice management system in terms of data. That was the heart of your business, right? And anything that's in your practice management system is dependent on a human to enter in a patient's details, enter in the information into the chart to know what needs to be treated. That's all the reason why we're here and why we practice dentistry. Pearl is the first tool that allows operators to understand the very top of that funnel. What are the total amount of opportunities? We call them dental opportunities. Think about any type of treatment plan that you would need for a patient. What's the total amount within each practice? And then it becomes really fun when you talk about operationalizing that data, which we'll talk about in a minute here.
All right, now Matt, this is the part of the show now. He's my technology expert, and he does a deep dive and looks into all this stuff as we get ready for each segment. What do you think of this? Or ask your questions.
I'm actually going to pivot because I've learned one thing about dental, and I actually went back and audited all of my LinkedIn posts and newsletter articles and all this stuff from the last year. And what I learned is that this industry, as you guys know, you just got a connector award, is all about the people. So I'm interested in asking you a question about you. Pearl's been around since 2019. You were not with Pearl, and now you are. I'm curious your thoughts on the early days of AI, looking at Pearl come into the market, what you saw, and maybe why you made the switch to doing what you do now. Because I think overall, this industry loves to hear about the people behind it. You're a person behind it that a lot of people know. So I think it'd be interesting to hear that story.
Sure, I'm really passionate about this. I came to Pearl for a very specific reason, which I'll walk you through. But your original question was, what was Pearl in 2019? How did it evolve? And really, why did I decide to dedicate my career to Pearl and what we're doing here? Well, back in 2019, the word AI was not as common. ChatGPT wasn't around yet, obviously pre-COVID. It was a relatively new idea. Pearl was the very first diagnostic or dental diagnostic AI tool to get its FDA clearance. We're now, by the way, the first to receive both 2D and 3D FDA clearance. We have over 25 clearances at this point.
Is 3D out yet? I'm just curious. I don't mean to interrupt.
It's out. We're in the middle. It's very complex. I don't want to talk too much about that, as you can imagine. But we have it with quite a few DSOs right now in a very small, controlled environment. I expect it to be released to the general public by summertime.
All right, well, we'll talk about that later, but Matt was making a good point. You had an amazingly successful career in the DSO industry. I followed you for a long time, but you decided to join Pearl, and you were telling us about that.
Yeah. This is the future. This is where we're going. One of my favorite quotes that I've ever heard is, AI is not coming to take your job, but someone who's using AI will. And so I really made it my mission to understand, where is this technology evolving? Where is it going? Before I was at Pearl, I was director of sales, of enterprise sales at Henry Schein One of the largest digital technology platform companies in the space, and we've really specialized in practice management systems. I think that in the old world, or even where we are today, we're reliant on what the practice management system gives you in terms of that's how you manage not only your patients, but your schedule, even your employees to some degree. We're really shifting to a different world where instead of going to your practice management system, pulling up some dashboard that used to be the most amazing thing, we're now going to be interacting with software in a very different way, very specialized to the operator, the person using the system. And it all starts with the clinical radiologic tool, because that is the beginning, that's the foundation. And I truly believe that's going to be the most important piece of how our employees and patients interact with their dentist of the future.
Do you see like an end-to-end system where Pearl is is that beginning and also the end, like working through a complete ecosystem of sorts, if that makes sense? Like, because I feel like you've got access to some of the most important data, and just taking Pearl and almost being like an operating system of sorts. Is that your take and also Pearl's take on things?
Yeah, one thing that we haven't talked about is the insurance game, right? So clinical diagnostic tools are incredibly helpful because obviously you're being more consistent across a DSO, but even just more consistent in your diagnosis, whether you're a private practice or a growing conglomerate or large DSO. But where it becomes really interesting is once you have the clinical clarity that AI brings you, you're no longer fighting with insurance. Insurance company understands and has more clarity about what you're submitting, so the pay cycle becomes so much shorter when you use a tool like this. So when you talk about end-to-end, it's not just the clinical side. It eventually connects into impacting clean claims or even submission rates, acceptance rates, which can have a major impact on these organizations.
Enterprise value, like all of those things, right?
What you're doing is you're adding an element of objectivity to something for 100 years that has been subjective. The first part that was subjective, it seems to me, is the patient in the chair. The dentist pointing to some black and white thing that you can't really decipher. It looks like ghosts on Halloween or something, and you can't really figure it out. And as the patient, you're not empowered in any way. You're just sort of at the mercy of just sitting there and trying to understand what's being told to you. So that's first element of subjectivity that now you're adding objectivity to with the pink dot over it. And then you're adding a further element of objectivity to insurance claim review process. Remember the battle of the experts. It's like our expert says it isn't a cavity. I say it is. And it goes back and forth, and it often ends up in nasty disputes and hold up of funds that that you should have, a recoupment of funds. But now if you're like, look, the AI caught it, it's right there, it's documented, it becomes very difficult for the insurance company to, like you said, clean claims. It becomes very, very difficult, for them to contest it. And it adds sort of an element of objectivity to one, the insurance audit process, and also to the patient experience process as to whether there's something, there or not something there that needs to be addressed. And it also allows, we haven't talked about this, but for example, another company, we're going to have them on here another time, Curodont, it allows sort of interplay between if you do notice a very, very early stage lesion, and that's exactly what happened to me on my trip to the dentist.
I saw it.
McKenzie knows that. We found an early stage lesion. They treated it with Curodont and then came back 3 months later and it was gone. I mean, I think it's an overall better patient experience is what it seems to me, McKenzie.
Absolutely. I'm going to comment on from the DSO's perspective and from the patient's perspective on what you just mentioned.
Do you actually comment on the operations teams, like everybody involved too? Sorry to interrupt.
Sure, I'll get all four.
Like everybody.
I just got off the phone with they're about a 650 location DSO. They're using Pearl in a subset and rolling it out to the larger enterprise. Just in January alone, they combined Curodont with using Pearl to detect incipient lesions, which is early stage decay. They added $50,000 worth of treatment that was completed, done, and finished just in 1 month, piloting Curodont in a very small set of offices. So when you're a DSO talking about, increasing same-store growth, there is no faster, simpler way than just by providing quality diagnostic care and also a procedure like Curodont that's non-invasive. It's effectively a paste that you can wipe on the tooth to restore early-stage decay. Every patient doesn't want to drill, right? They would way rather do something that helps them to restore the tooth rather than having to replace it altogether. And Pearl and Curodont could not be a better combination to do so. It's also really impactful because it's hard to see early stage lesions. That's why they're early stage. I'm sure I'm not a clinician. However, I've worked with clinicians for the better part of the last 10 years. We all miss things. We're all busy. And I think early on when Pearl came out, there was this almost like fear, like, oh, dentists don't want the big brother. They don't want someone telling them what to do. That's really gone away, and it's now become a clinical supportive tool. That's why it's called second opinion. So now a doctor, in combination with Pearl, can have Pearl up with their pink dot, showing this very early stage cavity, and now they have the clinical autonomy to decide, Is Curodont the right procedure here? Do we want to keep it as a watch tooth? Or is it potentially something greater that we need to address now?
McKenzie, this feels like an every office kind of technology at this point. Reminds me of the early days of scanners, digital impression scanners. They weren't very good, maybe at first. And I'm not saying Pearl wasn't very good at first, but you get what I'm saying. Now it also feels like an every office kind of thing to have, with a major impact, not just to the clinical teams, to like all stakeholders involved. I think you probably agree with that, right? The other question is around like key stakeholders is interesting to me, meaning at a DSO, you have all the different levels of individuals that this can affect in the decision-making process is probably a pain to you in some cases, having to have so many different types of conversations, but maybe can you talk to those two comments?
Sure. So, first, does this affect every practice? Absolutely. We've talked about, early stage decay or cavities, but we also detect implant opportunities, periapical radiolucencies. If you're looking at bringing specialty into your practice, you want to find out which are your endo patients. There's a lot of different ways that you can use these clinical tools to decide what line of business you might want to open or if you want to bring in a certain specialist. But does this apply to every practice? 100%. We're actually cleared in over 120 countries. So we have team members all around the world, even though we're only 6.5 years old. So that took a lot of work, but we don't just get our teeth cleaned here in America too. So there's our mission is to elevate the standard of care for billions of patients worldwide. So that's a really big piece of it. But your second question was, how does this impact other people within the practice that aren't the clinician? Is that your question?
Just everybody. I think it's an interesting dialogue, right? The conversation you have with the CEO of a DSO compared to a COO, compared to a CFO, compared to a partner doctor, associate doctor, the assistants looking at the images, right? Like it's just such a multi-level conversation. You're touching so many parts. Absolutely. Ultimately, the end goal is the patient experience and making sure they have the best care. I just think it's interesting to think about the dynamics that you're up against when you're having this conversation.
Yeah. It all starts with treating the patient ethically and accurately. If you start there, everything else will fall into place. The reality was before Pearl, we had no way to measure that or make it objective. So you had to just rely on your team, which is great, but this is where AI becomes so incredible for our universe, right? Is you're now able to use this tool to proactively measure and figure out what's your next step going to be. So once we start with accurate care for every patient, now let's think about the different dynamics within a DSO. Well, if you're a CEO, when you implement Pearl, you know that immediately, right off the bat, with relatively no friction, because it's integrated into your imaging system today, it's one of the few tools that you can implement and start to see results within one single day.
Well, so stop on that. Very important. I like what you're saying about the results in one day. But first, you said integration. Are you integrated with everything, or I want to talk about
I think we're at over 35 imaging systems. 20 different practice management systems worldwide. So
yes.
Well, that's a question.
We
always ask that question here
yes.
because one of the biggest obstacles to adaptation of new technology solutions is lack of integration. So I always stop sort of right there. So Pearl is integrated with virtually everything out there.
We also work with a lot of DSOs that maybe haven't centralized their practice management or imaging systems yet. Maybe they acquired a bunch of different practices for different reasons. Pearl then can become that standardization tool. Because we integrate with all the different imaging practice management systems, Pearl's dashboard and data center basically allows you to have a top-down org-level view of all of your offices in one place.
Even if they use multiple PMS.
Even if they use different practice management or imaging systems.
Now, the point you were making is one that I've covered a lot when I talk about diagnostic AI, and I think you were saying you turn this thing on, and literally on day one, and I want to emphasize this, it's an ethical way to do more cases, increase your revenue, increase your EBITDA, increase your enterprise value. Obviously, when people say, oh, this is going to make us do more cases, sometimes people get a little cringy. But this is an ethical way to do this because, again, the AI is only objectively going to catch things that are medically necessary.
You're exactly right. And I also say that the AI can help you from doing procedures that you shouldn't be doing, right? There's the opposite way of looking at this because Pearl will tell you how far the disease has progressed. And then it's up to the doctor to make that clinical decision. But how often how many claims are written off a month on average for a private practice or a DSO? It's significant, right? So if you can ensure that every claim that you're sending has the clinical proof behind it, you're only decreasing that amount of time of the payment cycle and the insurance cycle from the time you submit the claim to you're actually getting paid, because there's less need for that clinical review. Sure, if you don't know this, for an insurance company to deny a claim, it actually has to be a licensed clinician to deny that claim. They cannot use any tool to just go and say they're going to deny you. It has to be reviewed. That's expensive. That takes time. That's expensive for the insurance company and for the DSO. So using clinical AI when you submit those claims is actually a benefit for all.
A question. Remember, I did send a doc over to you for a 5-location DSO at one point, and he just called me up and said, which one and why? Like, they all seem pretty much the same. And he wanted to know which one, and obviously I sent him towards you. But just in general for the people watching, like, if they feel that all of them are very similar that are on the market now, like, why are you the differentiator, and what's your differentiator?
Yeah, no, great question. I get asked it all the time, and happy to answer it here. There's a reason why Pearl is the largest global footprint of any of the radiologic AI companies, and it's for a couple of different reasons. We are a provider-first organization. What that means is we have always and will continue to support providers and ensuring that not only everything we just talked about, everything is clinically accurate, but that they are supported when they need to send or present anything to an insurance company. That is very different than the other AI companies that are out there. We will always support the providers. That is where we believe is the most important and ethical way to approach the AI game, if you will, over the next few years. But also when you look at just the details, that's really more of our foundation and what we're doing. But if you're asking me, like, technically, what are the difference between the different companies? Pearl is the only integrated clinical AI tool that integrates not only with the imaging system, but also with the practice management system. So we also have a AI-guided schedule view, where not only can we show you where there are patients that are coming in for that day that maybe have undiagnosed treatment that you should look at, but also suggest where in the schedule you might be able to move them or move someone around so that you can maximize your day. Pearl is a very operational-led platform.
It's important.
It's
I'm not sure I knew that.
Different.
I'm not sure I knew that either. So can you expand a little bit on that part of it?
Sure. So they probably all sound similar because you're just thinking of x-rays and colors on an x-ray. And sure, that's all you're evaluating. You're using 2% of the value behind it. I'm glad you're getting that 2%. But what goes beyond that is how it all integrates together. I think I heard you earlier on your show saying that there's so many different AI platforms out there. Do you want a different insurance verification tool, a clinical AI tool, and everything else to manage your system, or do you want it all in one place? What Pearl does uniquely is not only do we offer clinical insights natively to your x-ray system, this is what we all talked about, this is the radiologic AI solution, but we also embed all the way throughout the practice management system, highlighting different opportunities in the schedule, whether you have a patient that's coming in today that maybe has an implant opportunity that has never been discussed or never been treatment planned, but we also are able to verify their insurance before the patient comes in. So this means when you use the Pearl AI platform, you're able to see what patients are coming in, what hasn't been diagnosed, and of everything they're coming in for, what are they eligible for? Because we all know, even personally, when you decide what you're going to do with your dentist, it is a partial financial discussion. And that's where Pearl is very, very different, is we offer very comprehensive, very detailed insurance breakdowns that integrate with that schedule.
Well, that's very, very interesting. So it will embed in all aspects of the PMS system as opposed to maybe just the X-ray portion, is what you're saying. And I'm not sure I knew that, Matt. So, if somebody's coming in and the Pearl's review of the X-ray indicates potentially an implant opportunity, it will note that. And what will it do? It'll note maybe a point in the schedule where you could potentially schedule an implant or something like that?
In Pearl's platform, we call it the daily huddle. So it's the AI-powered daily huddle. Doctors are really used to doing this on a daily basis. Right. They come in the morning, they look at their schedule. Pearl will show, well, what you can see in the practice management system is scheduled treatment and unscheduled treatment for that patient by the hour. Pearl adds another column, AI predicted opportunities for those patients. What did Pearl detect that hasn't been added to the treatment plan, that hasn't been diagnosed? So if you're a doctor working for a DSO, you could go into Pearl's schedule and filter to just see your patients that are coming in for that day, and how many of your patients have undiagnosed treatment opportunities, or obviously if they're not diagnosed, they're not scheduled. This is where you unlock the most potential because your patients are already coming in. You didn't spend $1 on marketing to get that patient in the door. They're already your patients. So not only are you presenting a fully comprehensive treatment plan, but you're making sure nothing goes unmissed or goes missed.
Yeah, I mean, something we talk a lot about on this show is, compliance. And, I think I'm in my 31st year of being an attorney, I want to just confirm a couple things to anybody, and you can agree with me or not, but Pearl doesn't have a dental license, cannot practice dentistry. No. The dentist has, in an extreme case, can ignore it completely if they want to. They're not obligated to utilize it, but it's supposed to be a second set of eyes.
That's why the product is called Second Opinion.
Well, you did say that earlier, and I walked into that one. But yes, it's sort of a second set of eyes. But, the dentist is, as we all know, legally responsible from the beginning of the case to the end of the case. Pearl in no way changes that, but it gives them sort of, I guess, like you said, a second set of eyes or a second reviewer to help them finalize what their diagnosis is going to be in that situation.
Yeah, exactly.
And in terms of compliance, I assume you can tell us for everybody what it's HIPAA compliant.
Absolutely.
Right. And you have FDA clearances?
Over 25.
We could have a whole show on compliance. That'll be...
Well, we're not going to do that here. That will bore everybody. Nobody will tune in for that show. But I just want to make sure when people watch this, they have the comfort of knowing you thought of compliance, and at least you believe it to be compliant. You also believe it to be HIPAA compliant, you said, correct?
Yes. We wouldn't be here without it. That's incredibly important. I actually had one doctor, and he's the chief clinical officer of a very large DSO that's been using Pearl for quite some time now. He actually called me and said, McKenzie, when do you think it's going to become a compliance issue to not have clinical AI?
Mm-hmm.
There were some panels. I was recently, like you said, I came back from the conference where the CareStack conference, they gave me that connector award, but there was technology was a big focus of that. And there were, some issues raised at that conference recently about, when is it going to be the standard of care? I got those questions sometimes on my panel, but, the dental board moved very, very slowly. The ADA moves very, very slowly. And, you're going to need to see some type of, recommendations from dental boards, possibly. The ADA may in the future make a statement on this, and that's going to take some time. So I don't expect, the standard of care to, evolve, in the next year or two. But that doesn't mean, at least to me, if there's a technology out there that enhances the patient experience, improves it, makes it superior, we can't use it.
Absolutely. ADA has invested in Pearl. So clearly, we're very close. We work frequently to make sure that we're only improving the standard of care. So
do we have any idea what the percentage of private practice or DSOs actually have implemented AI within their diagnostic?
It's improving rapidly. As you can imagine, 2025 was the fastest adoption year. It would be a guesstimate, but I think we're at about 25% of the market share. Or of the market has adopted clinical AI tools. I think that will only compound over the next few years.
All right, let's talk for a few minutes, because I talk a lot about this. What are the obstacles to implementation or adaptation? If you could tell us, McKenzie, what has worked really well, and when somebody, says, gee, we weren't able to implement this or it didn't go well, why does that happen, and how do you, prevent that from happening?
Great question. So let's take the technology piece of implementation and then the operational people side, because they're very different. From a technical perspective, it's actually overnight. It's actually even faster than that. We essentially connect to your imaging and your practice management system. We can sync your historical images overnight. So Pearl's detections are automatically popping up on your x-rays starting the very next day. That is very, very quick. What isn't quick is the adoption and the relearning of how to use a tool like this. So what's worked well was your question. If you're a DSO, or actually, let me start at private practice. If you're a private practice, you're a doctor, usually you're the one evaluating, doing the demo, and it's actually probably it's a lot easier to teach your staff why you're investing in this type of tool to help them be better clinicians themselves. Where it gets challenging as a DSO is whoever's making the decision at the, at the C level. Your operators might not be working with them on a daily basis. So what we've found is so critical is alignment from the C-suite on why they're investing in this type of technology. We also partner really closely with larger DSOs to create video content to help send out to the remainder of their organization of why they're making this decision. We're really excited. Pearl's being rolled out at all 1,100 plus Pacific Dental Services locations this year. So we've done a lot to ensure that every single doctor is educated on why they're making this investment and has resources to be trained. But the good news about a clinical tool like this is it doesn't take that long, and it's language agnostic. If you see a pink circle on your x-ray, you can kind of figure that's something to look at. It's not like there's this super long, comprehensive training program where you got to shut the office down like you do for a practice management system. It's a tool that you can implement seamlessly, but it gets a lot more fun when you pair it with Curidont and other tools that you can use to help increase the production numbers.
So this is a subscription-based product, a SaaS-based one, and I assume, as with other SaaS-based products that we've had on this show, the pricing is going to depend on how many offices and things like that.
Yeah, absolutely. And then, of course, the full suite. So, moving forward with the clinical AI tool as well as the enhanced schedule and insurance verification tools, get a lot sweeter pricing that way, and it's just better for you because you have everything in one platform. But, of course, just dependent on number of locations.
Is the Big Brother thing still a thing?
Not as much. It really isn't. I mean, I said this earlier. It's like having spell check. I'm educated, but I would never in a million years send an email without having it be ran through spell check. I know how to spell. I've got pretty good grammar, but I always want to make sure I'm not missing anything. And I think that's been adopted across the space.
I mean, honestly, it can keep some aging practitioners, at a high level for longer. I mean, I know, as older I get, my vision kind of goes downhill, and every time I go, they got to change the prescription. Thank goodness I'm not looking at x-rays or anything. But, this thing, I mean, to me, it seems like even if, you're aging, your vision's going a little bit or something, it's like you got a spell check there to kind of help you operating at a higher level for longer. To me, I've never, when I've spoken to doctors, ever understood the Big Brother thing. I've really always thought this could be, sort of an enhancement, to make them better is what I always thought.
Yeah.
But
one thing that we're working on right now that seems to be very interesting but is not widely adopted across the industry yet is we're working on automating treatment planning. So what that looks like is Pearl would find the disease, and then since the schedule and the clinical tools are all in one place, we can actually suggest what are high likelihood treatment plans for the doctor to choose. Of course, the doctor always has the decision, but this helps them be quicker and faster. As we all know, doctors are not very good at actually entering their notes and putting in their diagnosis into the odontogram back into the schedule eventually to be sent for an insurance claim. Pearl's helping automate that by giving them suggestions that they can then click, attach the right code, and start the whole claim creation process. So that's really what this is going to look like, is automating it from the very beginning when the patient walks in the door till they leave and you collect an insurance payment.
All right, I know the suspense is probably killing you. This is the portion of the show, the last couple minutes. Matt's our technology expert. You did a deep dive into Pearl. You've researched this extensively. What's your verdict on it?
It's nothing from the deep dive, but what we learned today about the practice management system and having the ability, these are my words, to have what sounds to me like a seamless way for integration to happen in so many different levels within practice and DSO, to not have to really be like trained up to understand it and to use it and have it automatically sense like what is going to be the right potential opportunity in the practice. And to be honest, this is the DSO, technology show too. Profitability is a real thing. You talk about it on stage all the time, Brian, like same store growth. You cannot buy EBITDA any longer, at least at this time. And it just seems to me having something like this inside of a DSO is a no-brainer. It's just a matter of committing to it, to making sure that it provides that impact for same-store growth. And obviously, down the road, it's always about patient care and patient experience. And I thank you for that information. I don't think I saw that on the website if looking, so it was great.
All right, so McKenzie, last final word here. If somebody watching this, is interested in learning more about Pearl, either implementing it in their office, or they got questions, or they want to learn about it, how best to do that?
Feel free to reach out to me directly. I think we'll have my LinkedIn below here. You can reach out to me there. My email is McKenzie@hellopearl.com. You can also go straight on to hellopearl.com's website and request a demo there.
Well, thank you so much. This has been the DSO Technology Show. I'm Brian Kaleo. I'm here with my co-host, Matt McGowan. Our special guest today was McKenzie Fagan of Pearl. And so great to be with you. And stay tuned for new technologies.